Benaviste affair, a research scandal. Most recently, a study published in the British journal Nature has elicited an even greater storm of controversy, not only over the data presented, but over their political implications as well. Dr. Jacques Benaviste and his colleagues at the University of Paris reported on a study of a type 1 had long advocated. The problem of dealing with any possible mechanism of action using dilute solutions is compounded by the variable and complex chemical nature of homeopathic preparations. I have therefore urged that single chemicals of a known biological action be subjected to the same dilutions and mechanical agitations as homeopathic preparations, with tests for their biological actions being made after each dilution succession. Dr. Benaviste used antisera produced against immunoglobulin B, IgE, the human hypersensitive antibody. In the test tube, the reaction between antiserum and IgE produces a specific response that is revealed by staining certain human white blood cells with specific dyes. While other simpler systems could have been used, I believe that Dr. Benaviste used this system because it is the basic biochemical process in the allergic reactions that were the subject of Riley's double-blind experiment. Benaviste found that as dilutions increased beyond the point at which there were theoretically no molecules of antiserum present, successive peaks of cellular effect were observed. In other words, the cellular effects appeared at some dilutions, disappeared at higher dilutions, and then reappeared at still higher dilutions that were well beyond the theoretical limit at which the last molecule of original chemicals was still present. He concluded that either some of the anti-IgE antibodies were still present even at these impossible dilutions, or that the essence of the anti-IgE had been impressed upon the water molecules in some fashion. When he submitted his paper to Dr. John Maddox, the editor of Nature, it was decided that Dr. Benaviste had to obtain confirmation of the effect from several other laboratories of his choosing. This process consumed 2 years. When the other laboratories reported the same findings, Nature published the paper, along with an editorial comment that there was no present physical basis for the observations and that there are good and particular reasons why prudent people should, for the time being, suspend judgment. On the face of it, this is a reasoned scientific statement. However, on reading the entire editorial, one finds that the good and particular reasons are the present laws of physics, such as the law of mass action. One does not find any indication that these laws might require some adjustments when dealing with such extreme dilutions of active substances. In short, what was being protected was simply dogma. The system of the scientific checks and balances following the publication of a controversial paper consists of other scientists attempting to verify or disprove the reported findings. This cannot be done in this case because Maddox's editorial has tainted the subject. No established scientific researcher would risk his or her reputation by attempting to reopen the controversy. Concurrent with the publication of the paper, Benaviste was notified by Maddox that an investigative team was going to visit his laboratory. The team would be composed of Maddox, a physicist, Dr. Walter W. Stewart, and self-appointed scientific fraud investigator from the U.S. National Institutes of Health, and James, the amazing Randi, the professional magician recently turned scientific fraud detector. Maddox's position had, of course, been spelled out in advance in his editorial. Stewart had no specific qualifications in immunology, which is how the Benaviste study would have been classified, and Randi lacks any scientific credentials. It is obvious that Maddox suspected that Benaviste's study was fraudulent. A reputable scientific journal either rejects a paper or notifies the scientist's home institution of its suspicions. In neither case is a paper published until the suspicions are resolved. According to the investigative team, they found poorly controlled conditions in Benaviste's lab, and when the experiments were performed for them, the results produced were no better than chance. In his letter of rebuttal, Benavisa wrote that the team had behaved in a totally unscientific fashion while at his laboratory. Positive findings were disregarded, his personnel were prevented from doing their work adequately, and the atmosphere was that of a witch hunt. The story has been widely reported in the world press, generally with a mocking attitude towards the data presented. The water that lost its memory. Time magazine, August 8, 1988. Dr. Maddox has adopted the stance of defending the laws of physics, but what he really appears to be doing is defending the biomedical status quo against a heretical concept. Somewhere in all of this, the spirit of true scientific inquiry has been lost. It is the best to defend the status quo and reject new scientific data simply because these data may pose a challenge. Or should we seek new data and revise our laws accordingly? The history of science is one of progress made after the latter path is followed, no matter how difficult this may have been. A new angle on the scientific basis for homeopathy. The key problem in homeopathy is the dilution of the active solution far beyond the point at which even a single molecule of the original substance remains. Many theoretical attempts have been made to explain this, usually on the basis that the solvent molecules, in this case water, undergo changes in configuration and somehow become imprinted with a specific pattern imparted by homeopathic material. The difficulty with this approach is that the water molecules would have to be able to assume as many different conformational changes as there are specific effects of homeopathic remedies, not a very likely occurrence. The importance of succession suggests that the molecules of the active material may be the ones that are changed by disruption of bonds attaching the active groups to the parent molecule. Active groups may consist of a few atoms in specific configuration that act by binding to the cell membranes. Such small groups of atoms are usually surrounded by a shell of structured water molecules, which have properties that are different from those of the rest of the solvent. This hydration shell of structured water may itself have configuration that reflects that of the active group. In this fashion, the solvent water may theoretically be considered to have been imprinted. 12 days after Benefici's paper appeared, a paper published by Jacob Israel Chevelli and Patricia McGugan of the University of California at Santa Barbara reported on some complex experiments dealing with the forces between surfaces and liquid solutions. The authors were able to measure oscillatory forces of attraction and repulsion related to a number of factors, such as the concentration of the solution, at very small distances from solid surfaces. They made the point that these types of forces may have been fundamental implications for the biology of cell membranes, and that much remains to be learned about them. In short, we really do not know very much at all about energetic actions over extremely short distances in very dilute solutions. The law of mass action may hold very well for the usual case, but it works poorly, if at all, in a very dilute solution that has been subjected to mechanical agitation. Obviously, when we study the actions of highly dilute solutions and the forces acting on solutions at the level of the cell membrane, we are involved in the area in which our knowledge is far from complete. The structure of most biologically active molecules is exceedingly complex, and relatively few investigators have been determined enough to plot structural maps of their atomic relationships. In solutions, these actions are even more complex. In contrast, our usual idea of the molecule simply floating about in the solvent, the entire molecule is in a state of constant agitation known as Brownian movement, which results from the thermal agitation of the smaller solvent molecules. Further, a complex biological molecule is itself constantly changing. For molecules fold and unfold about certain chemical bond angles, and active groups are rotating about their bonds literally millions of times per second. To this, we must add the constant motions of electron clouds about each atom of the entire molecule. The beaker of the solution that seems to be sitting placidly on the table is actually teeming with activity. Modern technological medicine in the main looks upon therapeutic drugs as agents that attack other agents that have produced disease, since the body itself plays no major part in this scenario other than being the place where the action occurs. One has to administer enough of a drug for it to act effectively. In chemical parlance, one adds the drug to excess so that the reaction with the disease-producing agent proceeds to completion. The idea is well and good for the situation in the test tube, but clinical medicine is not conducted in test tubes. If we accept the point of view that the body can heal itself through its own energetic systems, things seem much different. The cells of the body respond to energy in the form of electron transfer. The electrons are carried by chemical structures that fit into matching chemical structures on the cell's surface. These chemical structures may be small parts of a much larger molecule, but the active group that carries and transfers the electron may consist of only a few atoms in a particular geometric configuration. This concept has been partially explored and confirmed, particularly in the case of enzymes, immune bodies, and certain toxins. If we look at homeopathy from the perspective of bioelectronics, a different picture of its mechanism of action emerges. How many molecules of a substance are required for a biological effect? If we use the standard pharmacological concepts, we need a respectable number of molecules. However, if we're dealing with biological chemical sensing systems, fewer molecules are necessary. For instance, pheromones are complex chemical sex attractants that are released into the air, particularly by insects. Obviously, the total number of molecules is small, and that number is rapidly diluted in enormous extent by the air and by the wind currents. If they work very well, male moths respond to such unseen cues from miles away. It has been found that even one molecule of the appropriate pheromone will trigger the appropriate neural circuits, causing a male moth to fly toward the female. When you consider that the essence of this action is only a single active group and the transfer of a single electron, it becomes even more remarkable. Again, the biological factor enters into the equation. Living organisms have developed reactive systems of exquisite sensitivity and selectivity. While this illustration is drawn from our present knowledge of the olfactory system in insects, similarly sensitive and selectively can be demonstrated in the immune system of higher animals. The homeopathic preparation need only be capable of transferring a single electron to the appropriate receptor group on the cell surface in order to call forth a major biological response. A final consideration in our search for a rationale behind this action of homeopathic preparations is the body's own reaction systems. I've been struck by the fact that most in homeopathic treatments, the first reaction is a worsening of symptoms, with the symptomatic relief coming later. To the homeopathic physician, this initial stage is encouraging. It's a sign that he is on the right track. It is significant that the experimental groups of patients in Riley's study cited above demonstrated this effect. Since this was a careful double-blind study, the reaction cannot be attributed to a placebo effect. The phenomenon has received little study, yet it could contain a major key to the mechanisms involved. What functional systems are involved in it? Very likely the immune system is a major contributor, and its actions can be fairly easily monitored. It would be significant if in the course of another similar double-blind study, indices of immune system reaction were found to increase during the period of treatment. In actuality, any studies of the type performed by Riley can only support the clinical validity of homeopathy. They cannot reveal the mechanisms of actions. Studies of the type performed by Benaviste can come closer to the mechanisms involved by showing that something active still persists even in possible dilutions. However, Buenaviste's choice of a biological assay, a reaction of living cells, to demonstrate this is technically difficult. There are other methods of assay, such as the electronic resonances, that could yield more objective results. The primary problem is to overcome the innate prejudice against homeopathy so that adequate studies can be done. Homeopathy and traditional pharmacology. On a more mundane plane, homeopathy has something else to offer to the traditional pharmacology. Many of the homeopathic preparations in common use today contain active materials that appear to be much more effective than the synthetic drugs used for the same conditions. In my experience, the homeopathic ointment arnica, prepared from the leopard's bane plant, has remarkable local pain relieving, anti-inflammatory, and fibrinolytic clot dissolving actions that are far more effective than those of any standard pharmacological agent. Arnica ointment, however, is not a highly diluted succussed preparation, and it does contain measurable amounts of large number of substances. some of which have truly astonishing clinical properties. Its local effects are due to some direct chemical action. Arnica is also available at standard dilution and succuss preparation that is used systematically and is purported to be equally effective, but I have no experience with it in this form. In many years of orthopedic practice, I have treated hundreds of sprained ankles. This condition involves a tearing of the soft tissues, such as the joint capsule and ligaments, resulting in pain, swelling, and hemorrhage, the purple bruise into the tissues. I have seen fads and treatment for this condition come and go, injecting the area with Novocaine and making the patients walk, putting the leg in a cast, wrapping the ankle with an elastic bandage, and giving the patient cortisone. The least harmful of these treatments, putting the leg in a cast and gradually permitting the patient to walk, results in a healing time of at least 3 weeks. It takes even longer for the discoloration of the blood clot to disappear. The most harmful treatment, injection of Novocaine, which is no longer advocated, results in recurrent pain and swelling and often a complete tearing of the ligaments when the patient walks on the ankle. This treatment has frequently resulted in the ankles becoming unstable and requiring corrective surgery. Provided that the ligament is not completely torn, I have found that simply rubbing on arnica ornament within a few hours of the injury results in practically instantaneous and complete relief of pain, a rapid and complete resolution of swelling, and a rapid disappearance of the blood clot. The average patient treated in this way is totally functional within 5 to 6 days. The most remarkable aspect of all of this is the efficiency in which the blood clot is mobilized and dispersed. I know of no other agent FDA approved or otherwise that can match the efficiency of arnica in this respect. As this is being written, the newest wonder drug is tissue plasminogen activator, or TPA, a chemical agent made using recombinant DNA techniques. The TPA dissolves blood clots in the coronary arteries to the heart, a major cause of heart attacks. While there is no question that it has saved lives, the drug is extremely expensive and may also have serious side effects. Since arnica has been around for centuries and its effects have been observed by many thousands of physicians, one can reasonably ask why its clot dissolving effects have not been investigated in a responsible scientific manner. Local application of arnica ointment works so well that it would seem desirable to evaluate systematic preparation for this purpose. There is another observation on the action of arnica that may be of great importance to energy medicine and to our idea of DC electrical system as being responsible for the conscious perception of pain. The immediate relief of pain by arnica depends upon the ointments being present on the skin at all times. If it is washed off, the pain returns immediately, but it can be relieved just as rapidly by simply applying fresh ointment. Even though the source of the pain is in deeper soft tissue structures, such as ligaments, the rapidity of the pain relief would seem to require that the ointment's action upon some structures in the skin proper. Could these structures be the neuroepidermal junctions that we previously proposed as the anatomical structures in the acupuncture points? If this is correct, arnica may act by blocking the action of these junctions, as acupuncture needles inserted into the same points do. Admittedly, this is still speculative, but it does provide a theory upon which to begin experimentation. It makes sense that what we perceive as pain is actually the signal that an injury has occurred. Since the skin is the junction between us and our environment, whatever pain receptor system is used should be located in the skin. Since local injury also produces reactions of swelling and hematoma formation in the tissues immediately below the skin, one may also postulate the existence of some local DC system associated with pain receptors, which might act to mitigate these reactions. Certainly, if one designing an organism such as a local system would be desirable from the point of view of survivability of the injured organism. Local pain may also be partially relieved by applying pulsed electrical current to the area. There has been some clinical application of this using transcutaneous electrical nerve stimulators, TENS units. These will be reviewed in the next chapter. I have found that the both arnica and TENS units are more effective for relieving pain in soft tissues than in bone. The pain of arthritis, for example, does not respond well to either agent. At this time, I cannot provide any explanation for this phenomenon. At any rate, further investigation of the complex relationships among pain, acupuncture, arnica, and local pulsed electromagnetic stimulation would seem to be a good idea. I found another homeopathic preparation to be equally useful in the local treatment of minor to moderate burns. The ointment Artica urens is derived from extracts of the common steen nettle plant. Local first or second degree burns of the skin result in pain, swelling, inflammation, and blister formation. Application of the Urtica urens ointment before blisters have formed results in immediate pain relief, disappearance of swelling and inflammation within 1 to 2 hours, and prevention of blister formation. Like arnica, urtica urens ointment must be kept on the injured area continuously and must be replaced if washed off. This treatment is much more effective than our treatments with topical cortisone or any other such agent. Obviously, third-degree burns or extensive first or second-degree burns require the immediate attention of a physician. Acupuncture, traditional versus electrical. Acupuncture, like homeopathy, is a symptom-oriented therapy. This is perfectly understandable given that both were developed many years prior to the identification of actual disease agents. Traditionally, the useful effects of acupuncture have attributed to the restoration of balance of the twin forces of yang and yin within the body. The mechanism of action is a philosophical concept that was developed long before we had scientific knowledge of how the body actually worked. Acupuncture therapy is totally empirical, with the system of meridians and points worked out over many years through trial and error. So while there may be truth to utility in the therapy, it may be encumbered by many non-essentials and anachronisms of dubious value. More recently, acupuncture has come to be viewed as a discipline of energy medicine operating via electrical forces. Attempts have been made to integrate this view with the traditional philosophical concepts of this technique. Some confusion and number of conflicting claims have resulted. Earlier, I described my colleagues and I became interested in this ancient technique and summarized the results of our experimentation. While we were engaged in this project, word began to come out about China that the technique could be simplified and made more effective by the application of pulsing electrical current to the acupuncture points. This did not seem to make much sense in light of what we were finding. When a colleague appeared one day with one of the Chinese electrical acupuncture devices, I eagerly tested it. Perhaps the Chinese knew something I didn't. I was horrified to find that the levels of current and voltage were very high. So high, in fact, they stimulated contractions of the local muscle groups. With such large electrical forces being administered directly to the acupuncture point, electrolysis and cellular damage had to occur. I decided that the Chinese had fallen into the same trap that many others were about to fall into. But the system seemed to work electrically. Let's make it work faster and better by applying substantial amounts of external electrical current to it. In the absence of full knowledge of the operating parameters of the internal system, this is a dangerous thing, and it is even more dangerous when the basic physical principles of electricity are not applied. The old technique of acupuncture is totally safe from this point of view. The insertion of the metallic needle into any part of the body will produce a very small electrical current, because the needle insertion produces a local current of injury, and the metal of the needle reacts with the ionic solution of the body. The traditional twirling of the needle may produce a pulsing current at a very low frequency. Applying heat to the end of the needle may slightly increase the reaction between the metal and the body fluids. This may involve a little more trouble and work than the newer method, but it's a lot safer. The theory that we derived from our experiments was simple, in accord with physical principles and supportive of classifying acupuncture as one of the reinforcement techniques of energy medicine. The acupuncture points served as booster electrical amplifiers for the very small DC electrical currents flowing along the meridian. The actual points could be structures identical or akin to the DC generating neuroepidermal junctions we had produced in the rat. The insertion of the acupuncture needle in close proximity to such a point would interfere with the electrical workings of that point. This idea appears theoretically adequate to explain the ability of acupuncture to block the transmission of pain sensation. All that is required is a blockage of the incoming signal that indicates damage that is perceived by the conscious mind as pain. However, what we found was the only first tantalizing glimpse of this system. In order to put this concept on a firm foundation, we propose to measure the passage of a signal along the meridian and then attempt to block the signal transmission with the traditional needle insertion. If successful, such a study would go far to establish the validity of this technique. The experiments would provide a firm basis for further study of this intriguing system. While I was certain that our data had proved that the acupuncture system does exist and has the capability of transmitting information, the proof that it was clinically effective was much more difficult to obtain. Despite much work by our other NIH grantees and other groups, the problem of distinguishing the effects of acupuncture from a placebo effect remained dominant. Almost all of the studies were double-blind and were directed towards blocking or relieving pain. There are any number of studies in the literature showing that the injection of distilled water is often as effective in relieving pain as an injection of morphine, providing that pain relief is the patient has expected. Since acupuncture involves the insertion of needles and the subjects expect pain relief, this could well have been what happened. We still have no way of objectively determining the presence or extent of pain, and so the placebo explanation has prevailed. Acupuncture, in the view of the medical establishment of the 1970s, was completely explained by the placebo effect. Despite a lack of objective scientific evidence, the clinical use of acupuncture is even greater today than it was at that time. Our scientific approach would have enabled us to evaluate other effects ascribed to acupuncture treatment, one of which is a measurable control over growth processes. While anecdotal reports commonly indicate useful effects upon tumor growth and remarkable healing of such degenerative conditions as arthritis, these reports are subject to a number of uncertainties. However, it is possible to theorize a connection between acupuncture and growth control based on the concept of the closed-loop negative feedback DC system of data transmission. For example, if the output healing system is called into action by signals entering the cerebral DC control area, then appropriate stimulation of the acupuncture system could produce the same effect. At this time, we have absolutely no solid scientific proof for this theory or for its actual clinical utility. While orthodox scientific medicine has turned its back on acupuncture, veterinary medicine is becoming a vital and most interesting area for further study of this entire system. Obviously, veterinary medicine offers one great advantage over human medicine. The placebo effect simply cannot play a role in any effect that is observed and documented in animals. Over the past 15 years, veterinarians have become increasingly interested in acupuncture as a pain-relieving and therapeutic technique. Results have been so good that an International Veterinary Acupuncture Society has been formed, and in 1987, the American Veterinary Medical Association, the counterpart of the AMA, came very close to officially recognizing acupuncture as a valid veterinary medical procedure. At present, acupuncture is being widely used in veterinary practice with great success, mainly as a way to produce general surgical anesthesia and anesthesia for chronic pain conditions. Surprisingly, acupuncture has been found to be very effective in the treatment of arthritic joints in animals. It has been reported to be clinically effective in increasing activity and relieving symptoms in 84% of animals that degenerative joint disease and that were unresponsive to standard treatment. X-rays taken before and after treatment of the involved joints strongly suggest that regeneration of the damaged joint cartilage has occurred. This, however, has not yet firmly established by autopsy. Similar results were reported in degenerative disc disease of the spine in animals. If autopsy or biopsy studies were done on these joint and disc and actual healing or regeneration was demonstrated, we would have proof of the ability of acupuncture to favorably influence the output side of the control system loop. The implications for human medicine are vast. Finally, veterinary acupuncture treatment has been shown to be remarkably effective in idiopathic epilepsy, epileptic convulsions occurring without any evidence for physical damage to the brain, a condition that had been resistant to other therapies. This confirms clinical reports of the same effect in humans, and with regard to the total DC control system, is very important observation. In both animals and humans, epilepsy is the spontaneous, synchronous discharge of a large group of adjacent nerve cells in the brain. This synchronization is the result of negative polarity shifts in the DC potentials in the area, which increase the excitability of the nerve cells. It is possible that the well-known aura of the premonitory feeling that the convulsion is about to take place is the conscious perception of this DC charge. The ability of acupuncture to effectively prevent epileptic convulsions in both animals and humans may well be due to changes induced in the cerebral DC system that result from appropriate changes in the incoming DC acupuncture system. The problem facing veterinary acupuncturists is a lack of funds to pursue the necessary basic research that could actually prove what is happening. Since in clinical veterinary use of the effects obtained by acupuncture cannot be due to any placebo effect, in addition to our having proved that the acupuncture system actually exists, we also have totally objective evidence for important clinical efficacy obtained through the observations of veterinary physicians. As a result, there has been substantial increase in the number of practitioners of acupuncture. Since the technique is officially non-existent, there are a few regulations concerning the training and qualifications of these people. Traditional acupuncture is complex and difficult. It is not something that can be learned by anyone, including a medical doctor, in a 3-day course. Many of the courses offered today stress the idea of using fewer points and treating them with one of the many electronic devices now available. I believe that this is a mistake. While my data indicated that acupuncture is based on the flow of DC electrical currents, these currents were minute in strength, and I had barely begun to evaluate the complexities of this system. My findings are not adequate to justify the application of externally generated electrical currents to acupuncture points, and I do not believe that the Chinese have any more substantive data. While there are any number of electronic devices sold, there are purported to be able to seek out the exact position of acupuncture points and to treat them with exactly the right amount of electricity. These are also not subject to any quality control. A totally objective evaluation of these devices is yet to be done, but such an evaluation cannot be done until we have some additional knowledge of the electrical characteristics of the acupuncture system itself. In short, the present situation is a mess. There are some physicians practicing acupuncture who are well trained in the traditional system. There are other practitioners who are not MDs, but who are equally well trained. Fortunately, there are also many practicing acupuncturists of both types who are poorly trained, lacking a basis of knowledge. They implicitly trust their electronic gadgets to do the treatment for them. The best advice I can give to any prospective patient is in general to avoid those practitioners who rely solely on various electronic devices for diagnosis and treatment. If you wish to explore the possibility of acupuncture as a treatment, first be certain of your diagnosis and know the possible orthodox therapies available. Then, if you still desire to follow this route, seek out a traditional acupuncturist. Other energy reinforcement techniques: vitamins, trace elements, and physical manipulation. There are a number of additional techniques that might possibly be placed in the energy reinforcement category. These include the use of dietary supplements such as vitamins or trace elements, and manipulative techniques of osteopathy and chiropractic. Of the vitamins, ascorbic acid, vitamin C is the most prominent in the lay press. It certainly has a prominent proponent in Linus Pauling, 2-time Nobel Prize winner. While this vitamin could theoretically play a role in the energetic and immune systems of the body, firm evidence for this is still lacking. Clinical trials of vitamin C on cancer patients are clouded with controversy. In my opinion, a valid trial has not been done. However, this area shows promise. In my practice, I have used moderately high doses of vitamin C on patients with chronic fatigue syndrome and have observed useful results. The trace element hypothesis is interesting, but there is little firm data on it. It is possible that some of the metallic trace elements, such as cobalt, play a role in semiconducting structures in the body, but this also remains to be proved. Manipulation therapy has enjoyed a long and clinically useful life, and many patients are convinced of its efficacy. It has been my observation as an orthopedic surgeon that some painful conditions of the complex joints may be relieved by appropriate manipulation. Once I was certain that such patients had no conditions for which manipulation therapy would be dangerous, I often referred to them as an osteopathic colleague. Note that this treatment is simply mechanical, and this is not related to the energy systems of the body. However, there are many osteopaths and chiropractors who postulate that their manipulations somehow balance these energy systems. Unfortunately, objective evidence for this idea is lacking. In the group of therapies that supplement the body's own energy systems with small amounts of external energy, there are several useful techniques with which some remarkable clinical effects have been demonstrated. These techniques appear to work by enhancing the intrinsic energy control systems of the body, and as such, they have some basis in scientific fact. But further exploration is required. The mechanisms of action of these techniques must be better determined. Their actual clinical utility fully evaluated, ways sought to make them more efficient and more reliable for larger numbers of patients. With the growing popularity of such therapies, the danger of intrusion by fraudulent practitioners is great. The best defense against this is establishment of a scientific foundation for the actions of all practitioners so that these treatment techniques may be acceptable to valid and clinical useful. Such techniques appear to be safe as long as they are employed in traditional fashion.